Good afternoon, ladies and gentlemen. Thank you for joining me this afternoon. I'm going to refer to my notes as I go along because what I want to do is start with an update and provide the latest information that I have, understanding that things continue to evolve. Currently, the news is reporting 23 presumptive cases of COVID-19 in New Mexico. What that means is it's not that 23 cases are confirmed, it's that they believe that 23 cases will be confirmed. And 17 of those 23 at this point are confirmed. I think it's important to understand a couple things as far as that goes. Of those 23, the preponderance of them are from Albuquerque. And of those, there is no known community transmission in the local area. And what that means is that of all the cases that they have traced back, and they're still working on it, on a few of them, that it is either come from travel and exposure from someone traveling, in the case of one couple to Egypt and coming back, or from somebody who traveled and has infected their household. And so there is no transmission outside essentially the household or travel, which is important when we consider what measures are being taken at this point in time. Also want to make sure that folks understand what's happening here at White Sands. And in White Sands Missile Range, at this point in time, we are tracking 9 people in quarantine and 1 in self-isolation. And that 1 is related to travel, and the ones that are in quarantine are either related to travel or in traveling, having come in close contact with someone, or in the case of a couple of them, we're in close contact with a person that is in self-isolation now. So again, we have no evidence of community transmission and are taking precautionary measures to keep it that way. Along those lines, services are open. And so when folks think about, hey, why are we still feeding people at the Frontier Club or at the bowling alley, and why are those services available? And the same thing with the gym. If you think about yourself, you come up with one answer, and you are your first line of defense. And so if you're not comfortable in eating in one of those places or working out at the gym, then please stay away, okay, and take care of yourself. But from an installation perspective, our workforce who is meeting the mission would be further exposed, and we would potentially increase the possibility of transmission if we ask them to eat elsewhere or find food to be able to eat other than those places. And so we're taking the preventive measures, and we are trying to maximize the opportunities to protect our community. And along those lines, that's based on the current assessment. And if that changes, then we will change things accordingly. And so again, first line of defense is you, and I can't emphasize that enough. That said, cases have increased in New Mexico. Accordingly, we're going to take a few measures starting essentially effective tomorrow morning to limit folks whose place of duty or don't live here. And along those, the museum will be closed until further notice. The off-post bowling leagues are suspended until further notice. The DMV will be limited to folks with access to the installation, and the same thing with our ticket office. The intent is to take rational measures given where we are, and if the status changes, we will reevaluate whether or not those measures are sufficient. So along those lines, the garrison commander is putting up a sign inside the Frontier Club because people like to come to the club, and even though there are hand washing facilities and the restrooms there, instead of taking a right as people go into the club, they just make a beeline to the left for the food. And so we're asking folks to really do 2 things and putting the sign up to remind them. Number 1, wash your hands. If you're going to touch food, if you're going to sit down and eat it, if you're going to carry it, take the opportunity to wash your hands. And if you say, well, why don't you put hand sanitizer there? Hand sanitizer is a measure to be taken when you don't have soap and water to wash your hands for at least 20 seconds vigorously. And so that's where we want to start. We want folks washing their hands to be able to protect themselves. The second thing I would say, whether it's at the Frontier Club or any other place, practice social distancing. There was a clip on the news last night of a guy who made a PVC pipe extension to wear that more or less protected him from anybody coming within several feet of himself. And while the news made fun of it, the fact is social distancing is going to help prevent the spread of any disease that's communicable if someone has it. And so when you're in someplace and you got to wait in line, stand back 3 to 6 feet. And if somebody wants to jump in line in front of you, just politely say, I'm practicing social distancing. The line forms behind me or whoever the last person is in line. And let's use common sense. There was feedback that I got from a couple of different places that I told everyone yesterday in the video that we made in the live stream that supervisors had the answers to everything. Let me be clear. Nobody has all the answers. And this is evolving, so even if you do have the answers, you need to make sure that they are current. What I meant to say, and if I misspoke, I apologize, is talk to your supervisors. Because each case and the employee relationship and the work you do needs personal attention. And have the conversation with your supervisor about what opportunities there are, what concerns you have. And if your supervisor doesn't have the answers, okay, what I ask supervisors to do is talk to your supervisor. Bring up the questions you don't have the answer to. If you don't think you've got the authority and you think something makes sense, have a conversation and pass it up the chain. Understand, there is not one solution that fits everyone. That's true at the individual level, that's at the organizational level, and that's at the installation level. So I think it's important to understand when you look across White Sands Missile Range, I'm setting the minimum standard for the provisions that need to be enforced. We have tenant organizations and members of Team White Sands that work for different agencies. And they can be more prescriptive, and in many cases are being more prescriptive. And so if your leadership is giving you different guidance, which is more prescriptive, then you need to follow that guidance. And again, use common sense, and you are your first line of defense. Similarly, each of the installations that surround us, whether it's the Air Force bases in New Mexico or it's Fort Bliss in Texas, has different conditions than we do. They have a different mission set than we have, and they have different challenges. And therefore, the response is going to be different. And understand that it's a matter of understanding what the circumstances are at the local level and what is the appropriate response to be able to meet those. So I had questions about employees who've traveled to level 2 states. And why are they at work? Now let me be clear. WHO, the World Health Organization, is who puts level 2 and level 3 status. That is at the country level. It's not at the state level. Are there hotspots? Absolutely there are hotspots. But there is no place in the United States that says, don't go there, with one exception that's probably pretty close, and that's the governor of New York's area containment zone around New Rochelle, New York. That said, we need to use common sense. If you've traveled and are going to come back to work, then you should call your supervisor. Don't show up to work, and have a conversation with your supervisor before you come to work. If you believe somebody else in your workplace is causing you concerns about where they have traveled, then please have a conversation with your supervisor so they can address that concern. Now, there were a number of questions that were provided, and I want to get after those questions now. And when I say a number, I think we got 3 questions in between yesterday afternoon and midday today. And so the first one is, quote, can a DA civilian be forced to telework? Now, let me be clear. We don't force anyone to do anything. We direct people, and as a condition of their employment, the question is, can a civilian, actually government civilian, we'll go more broadly than a Department of the Army civilian, be directed to telework? And the answer is yes. Are there conditions? Of course. And the circumstances are going to depend on the individual case. If you have a signed telework agreement, whether it's routine or ad hoc, yes, you can be directed to telework. And there are other circumstances where you can be directed to telework as well. Furthermore, for the safety of the workforce, if there is a belief that your presence makes the workforce unsafe, then you can be denied access to the workplace. We need to work through those, and we need to be cognizant of what conditions are out there. I would ask anyone who believes that they may have been exposed to have the conversation. Again, preferably from a distance. Don't come to work if you think you may have been exposed. Have the conversation ahead of work time so we can be proactive about this and protect everyone in as much as we can. The second question, and I quote, what if a government employee that has a spouse who is also a government employee and they are both required to telework and their home does not support 2 connections to the internet? Again, supervisors need to be involved to be able to address the issues. I can tell you generally that there are lots of potential opportunities, but the specific solution needs to be worked out between each of the employees and their supervisor. And it may include flexible work schedules so that you're working off cycle with each other or intermittently where you're downloading things. Additionally, it may include an iPhone that is capable, is acting as a hotspot or a MiFi or a lot of other potential things. And so I would ask, have the conversation, express the concerns, and let's get them addressed so that we can take care of folks and make sure we're doing the best we can. The third question, and I quote, is, does anyone know about the incubation time frame for COVID-19? End quote. There's a second part to the question that I'll get to in a minute. The self-quarantine period and the isolation when they do the isolation of 14 days is based on the incubation period. Now, do we know everything there is to know about COVID-19? Of course not. But we do have tens of thousands of cases that have already happened in the world that have been analyzed. And that's where the 14-day quarantine period has come from. And it is expected that if you have COVID-19, that it will present itself within that 14 days. So that's the reason for that period. Now, the second part of that question was, quote, I have contacted McAfee and they stated I will be safe using my asbestos respirator. I would like to know if this is true for my safety and the safety of my family, end quote. And so what this question really revolves around is a respirator designed to, with charcoal in it, to be able to filter out asbestos and other materials that could be at this individual's workplace. And that filter, according to our medical professionals and the best we know at this point in time, will protect you from inhaling the virus and being able to catch it through that way. It does not prevent you from getting the virus if you touch it and then touch your eyes or something else. And so it's not a one-stop solves everything, which is why that's not all you see workers that are swabbing folks on the TV at drive-thrus in terms of protection. And so again, it's prudent If you think you're at a place where things are exposed and it's part of the personal protective equipment that our healthcare providers are going to wear if they think that they are in a case where they may be exposed, and it does potentially provide you with some additional protection. Masks generally for the public are to prevent you from spreading things elsewhere. They do prevent a little bit in terms of inhalation, but there are other ways to be able to transmit any communicable disease. Now look, those are the questions that we had as of midday this afternoon. We will continue to address questions as they come in. I think it's important for folks to understand that you are critical to everything we do. And having a sense of community and understanding that we're all going through this together and need to be mindful of each other, and when we do something, mindful of the impacts of that as we are practicing good hygiene and making sure that those that we are responsible, whether it's our employees, our children, or other dependents that we may have, are also doing the same and need to be vigilant throughout. So the question continues to come up: what happens when a case occurs? We are already quarantining folks who are potentially going to come down with it, and this is a case where COVID-19 is a reportable disease to the CDC, and that reporting goes through the state health departments. As such, we take direction and guidance from our healthcare professionals on how we proceed, and that includes when we put someone in isolation or quarantine, ensuring that we capture who we think they've had close contact and could have infected, so that we're already addressing the potential spread and taking precautions, or ready to take additional precautions if an over precaution turns out to be not an over precaution. So I would ask, continue to discuss, go to our websites, look at the information. There is a ton of information out there. There are general answers to questions and some specific answers to questions based on when they were written. And so that includes everything from the Office of Personnel Management guidance to CDC guidance to New Mexico and Texas guidance, as well as Department of Defense, Army, and other federal guidance. Again, look at those. If you've got questions, please ask those questions. I live in the community. I work here with you, and taking care of you is important and critical to this community and what we do. Thank you. I hope you have a good evening and look forward to addressing you again tomorrow.